John Muir, to me, is the best example of a community hospital that I could ever hope to be a part of. It is very unusual to have this number of fully credentialed intensivists in one location, and we're here because we love it. We do it because we care, because we want what's best for our patients. We're doing truly excellent patient care, and our community benefits from that. Something that I'm very proud of, something that we all are very proud of and are glad to give to the community.
With patients in the medical intensive care units, they are oftentimes very sick with multiple comorbidities and perhaps an uncertain future. And so with all of that fear and trepidation, having comfort in the way that you're being treated, and not just medically, but emotionally, that's a huge sense of relief.
We take care of patients who are at their sickest. A board-certified intensive care specialist, 24 hours a day on site. That's very unique and very exciting. Many hospitals don't have such a program.
One of the things that is done in the medical intensive care units at John Muir is the concept of a multidisciplinary rounds, which is a period of time in the morning when the entire team meets together at the patient's bedsides and goes over the plan of the day and assesses the issues that need to be taken care of for that patient. And it really facilitates the care of the sickest patients.
What's really important about our critical care team is we were already practicing in a coordinated fashion with our 24/7 intensivist program when the pandemic hit. We had each other's back and we had the community's back. So we were able to escalate our efforts very, very quickly.
What we learned from the pandemic is that there are many things that we shouldn't take for granted. And the ability to access intensive care was definitely one of them.
When you have a very highly functioning intensive care service line, very complex and challenging problems get solved. Part of our expertise is to do those things and to do them on a routine basis. So if you have a highly functioning intensive care unit, you don't hear about it much because everything's working.
No one wants to think about ever needing intensive care until it happens. And then at that point, you want the absolute best intensive care for your loved one or for yourself, because it is the difference between life and death.
Part of the reason John Muir has resources available to meet challenges like what happened in the last year is because of the generous community support that it enjoys.
Philanthropy in general allows us to get state-of-the-art equipment that we might not be able to obtain otherwise, allowing us to support our patients in the best way possible.
Code Blue Secure.
That's the beauty of John Muir Health. We can provide this world-class care that's cutting edge, but it still has that feel of your very comfortable community hospital. So it's kind of the best of both worlds.